My name is Kayla McCoy. I am the unit clerk here at Bow Valley College Hospital, and this is my client, Celine Provost. I'm going to tell you about what the posterior emissions tomography scan, or the PET scan, is. I'm also here to answer any questions you have regarding this procedure. So the posterior emissions tomography scan is an imaging test that allows the doctor to check for any diseases in your body. Your doctor may order a PET scan to inspect your blood flow, your oxygen intake, or the metabolism of your organs and tissues. The PET scan shows problems at the cellular level, giving your doctor the best view of complex systematic diseases such as cancer. Before the scan, you'll get tracers through a vein in your arm, through a solution you drink, or in a gas you inhale. Your body needs time to absorb the tracers, so you'll wait about an hour before the scan begins. After that hour, you will begin lying on a narrow table attached to a PET machine, which looks like a giant letter O. The table will then glide slowly into the machine so that the scan can be conducted. You will need to lie still during the scan. The technician will let you know when you need to remain still. You may be asked to hold your breath for several seconds. You will also hear buzzing and clicking noises during the test, so don't be alarmed. When all the necessary images have been recorded, you'll slide out of the machine and then the test is complete. The test can last anywhere from 30 to 45 minutes. There are no medications involved during this test. Your doctor will provide you with a complete instruction for how to prepare for your PET scan. Tell your doctor about any prescription over the counter or supplemental medications you're taking. A few days before, you may be asked to refrain from strenuous physical activity such as exercise in the next 24 to 48 hours preceding the test. The day before your appointment, you will be asked to stick to a low carbohydrate, no sugar diet. In the hours before, if you're receiving any anesthesia for the procedure, do not eat or drink anything the entire morning of your PET scan. Drink only a few sips of water if you need to take any medications. If you're not receiving anesthesia, you will still want to refrain from eating anything for 6 hours before your scan. Remember to avoid chewing gum or sucking on hard candy, cough drops, or mints. You'll be able to drink water, however, and take any medications as recommended. You may be asked to change into a hospital gown. Also, if you have any jewelry on you, including body piercings, we do ask you to remove those as medical can interfere with the testing equipment. So the PET scan involves radioactive tracers, but the exposure to harmful radiation is minimal, so the risks to your body are low. If you have any allergies or any other health conditions, you could possibly have an allergic reaction to the tracer. If you're allergic to iodine or any of that, you should alert your doctor. If you are pregnant or think you may be pregnant, you should not get a PET scan. So other risks of the tests include discomfort if you're claustrophobic or uncomfortable with needles. The injection site may also lead to some symptoms such as bleeding, bruising, or swelling. After the test, you can go about your day unless your doctor gives you other instructions. However, because radioactive material will remain in your body for about 12 hours, you will want to limit your contact with both pregnant women and infants during this time. Drink plenty of fluids after the test to help flush the tracers out of your system. Generally, all tracers leave your body after 2 days. I hope all those questions helped you in preparing for your PET scan. So what diagnostic imaging department would you need to contact in order to book the PET scan, which would be the medical radiology technologists or the radiologist department. You can also contact, if they're going to a different hospital, to contact that hospital. What additional tasks would need to be completed by the hospital unit clerk for the PET scan? The additional tasks that would need to be completed by the hospital unit clerk is to find out from the patient if there are any routine medications that are being taken. verify their identification and exams that are requested, have a contrast screening form ready to complete before the scan, check to see if there are any other orders the doctors may have given such as ordering lab tests prior to contrast being given. This is just to make sure that there is everything done before the scan and nothing has been missed. The other department would be the outpatient office from where the scan was referred from. The reason why is to make sure they know the scan has been completed and that the doctor should be receiving results in the next couple of days.